Hello. Shashank, am I audible?
Yes, ma'am, you are audible.
Okay. So let's start our today's session. It's the last session of this series. So a very good afternoon and warm greetings to one and all present here. On behalf of Samarpan Institute of Nursing and Paramedical Sciences, I extend a heartfelt welcome to all the dignitaries, esteemed speaker, respected faculty members, students, and guests who have joined us from across the country for day 10 of the National Webinar Series on Redefining Nursing Practice, focus on adult health and surgical care. It is indeed a moment of pride and privilege to have such distinguished personality with us today. I take this opportunity to extend a warm welcome to our respected speaker, Mr. Lavin Masih sir, whose present today is an honor and encouragement for all of us. Sir is currently serving as an associate professor at the MLB Government Paramedical Training College, Jhansi. Sir brings with him a total of 15 years of academic experience in nursing education. Sir specializes in medical surgical nursing with a strong focus on clinical teaching and student mentorship. He has authored and published 14 research papers in various national and international journals. His recognition for consistent contributions to nursing scholarship and professional development in the paramedical education sector. Today, sir will be taking class on emergency and disaster management. We are truly privileged to have you with us, sir. The virtual stage is all your. Welcome, sir.
Thank you, ma'am. I'm audible.
Yes, sir. Yes, sir. You are audible.
Good afternoon to all. Myself, Levin Masih, and I'm from Jhansi. I'm working as associate professor in paramedical training college Jhansi, and it is a great privilege for me that today I am here on this platform. And first of all, I like to give thanks to Samarpan Institute and especially Madam Dr. Niti Shukla, Madam, for their for making this opportunity and making this platform for all of us that we can come together and share our knowledge and share our skills and to make the professional more I can say qualitative manner that we can impart new things, new skills, new knowledge by sharing. So this is a very good time for us. And today, should I start the topic? It is visible for all.
Yes, sir.
So today we are going to study or have a session on disaster management. That is a very important topic in adult health nursing, and that is related. We can say we in last years we have seen lots of things in that, and it is very important that being a clinical or medical personnel and professional, we should be ready and we should be more skilled uh, to face such things, such problems, such disasters that we should be ready for that. And for that, the disaster management, if we talk about that introduction, that is about disaster word. Disaster word is originated from a Greek word and that is thus, and thus means bad. And aster, that is means star, and the root of disaster, that is comes from an astrological sense of calamity, blame on the position of a planet. That it is said like that as an astrological sense. We can say that it is like a calamity blame on the position of a planet. That the word which is coming from, it's depend on the position of planet. That dust means bad and aster means star. Actually, the definition we can say is that the disaster is a sudden calamitous event, bring in great damage and loss and destruction and devastation to life and property. If we talk about the calamity, which is calamity is what is it is a terrible event that cause a lot of damage or harm, a lot of damage to the human beings and harm and damage to the property, damage to the infrastructure, damage to the many things we can count it. So disaster is a sudden. If you say that it is a sudden, we cannot say that it has some timetable or it's have some regular way, but it is a sudden, can be any time, and it is a calamitous event which brings the great damage. We cannot count it, that damage and the loss and the destruction and devastation to life and property, both. Not even for the life, but also for the property, both. As we come to the definition of that is by WHO, that is any occurrence that cause damage, ecological disruption, loss of human life, deterioration of health and health service sufficient to warrant an extraordinary response from outs that affected community, that community area. So WHO has given that definition, that an occurrence that causes damage and ecological disruption. Ecological disruption, actually it is also known as ecological disturbance or ecological imbalance. Imbalance is refers like it is significant change in the natural environment that negatively impact ecosystem. That what ecosystem we are having, that have the negatively impact, and also it also have a negative impact on the biodiversity that you have studied about that, and human societies. These disruptions can be caused by both natural events like floods and wildfires, and by human activities such as deforestation and pollution. So that we are talking about the ecological disruption. So an occurrence that causes damage, ecological disruption, and loss of human life, and the deterioration of health, related with the health and health services sufficient to warrant an extraordinary response from outside the affected community area. That American Red Cross Society have said that a disaster can be defined as an occurrence either nature or man-made that cause human suffering and creates and does that need victim cannot be alleviated without assistance. Creates human needs that victim cannot be alleviated without assistance. That means American Red Cross Society, in this definition, they are saying that a disaster can be defined as an occurrence of either nature, or the nature by the nature or by the man-made, and that both will cause human suffering and creates human needs that victim cannot alleviate. A person who's suffering by this disaster, maybe it is because of man-made, maybe it is because of the nature, cannot alleviate without assistance, cannot come to the point or cannot be overcome to that because without the help of assistance. So that is our definition of disaster. Now we come to the classification classification of disaster. Classification of disaster. High Power Committee 1999 appointed by GOI or Group Disaster, and they have said that they have classified in these way that one is geophysical, hydrological, meteorological, climatological, biological, and extraterrestrial. And there are other like geophysical. If you talk about the geophysical, like this is classification. Like disasters are broadly classified into natural and human-made disaster. But natural disaster results from the natural phenomena that have the natural phenomena, while human-made disasters are caused by the human actions. Okay, that human-made is caused by the human actions, and natural was disasters are the result of natural phenomena. So natural disasters can be further categorized into geophysical, hydrological, meteorological, and biological. Geophysical is like earthquake, mass movement, and volcanic activity. These involve earth precession and movements. What it involves? It involves the earth precessions and movement. It related with the soil erosions, such as earthquake, volcanic eruptions, landslides, and tsunamis. So this is one of the classification, that is the geophysical, and the geophysical is directly it is related with the earth precession, or you can say the soil. Okay, so this is a geophysical. If we talk about the hydrological is hydro, and the hydra, it is related with the water. Okay, so hydrological, this involves water and its movement. Like we already heard about, like it's if the water is in the extreme way, it comes in flood, and if the water is have a scarcity, then it comes in droughts, and it is higher extremity, we can say tsunamis. So these involve water and its movement, such as floods, droughts, and tsunamis. Now, the third one is meteorological. Meteorological involves the weather. Weather is a storm, extreme temperature, it's fog. So that is the involvement of the weather and the climate phenomena, such as storms, extreme temperature, meteorological, cyclones, tornadoes, heat waves, and blizzards. So these are the related with the meteorological. Now, next is that is called climatological. Climatological is having it's related with the climate. Okay, it's related with the climate, and it's like drought, glacial lake outbursts, and wildfire. It's related with the temperature, climate. What climate we are facing, what climate is that? It is related with the climatological. So, next is biological. Biological is what? Biological is related with animal accident and epidemic like we have seen the COVID, insect infestations. So this is a biological. Now next biological is extraterrestrial. Extraterrestrial is what? Extraterrestrial is, you can say, it is an extraterrestrial disaster, refers to a hazard or event caused by object or phenomena originating from the beyond Earth atmosphere. It is from the beyond Earth atmosphere. Like this can include impact from what? It is include the impact of asteroids. It can include the impact of comets. It can include the impact of meteoroids, as well as changes in the interplanetary condition. Interplanetary condition में अगर कोई change है, there is any change in that, then the effect come to the earth that gives the extraterrestrial disaster. Okay, so the types of extraterrestrial hazards like impact events, like this involves collisions between astronomical objects, like such as asteroids or comets and the Earth. While most are small and have minimal impact, large impact can cause significant damage and even global consequences. This is about and the air burst. These are explosions that occur in the atmosphere. There are some type of explosions which occur in the atmosphere and they give the impact on the earth. It is called extraterrestrial disaster. Another one is geomagnetic storms. These are disturbance of earth magnetic field. They do what? They disturb the earth magnetic field and it's caused by the solar storm. That is caused by the solar storm. So this is about the extraterrestrial. Now we have studied about climatological. Climatological we can talk about is a long-lived process and large-scale impact. And these are like these disasters are not short-term event, but rather result from the climate variability that persists over long periods, from intra-seasonal to multi-decade. And large-scale impact is what? They affect regions or even entire continents, unlike localized meteorological events. Okay, like example, if we talk about like extreme temperature. Extreme temperature is what happened in that prolonged heat waves or cold snaps can cause widespread stress on the infrastructure and human health, both. And like for example, drought. So drought, a sustained lack of rainfall, can lead to water shortages, agriculture losses, and increased risk of wildfire. Some type of disasters can trigger the other disaster also. That we are talking about the climatological like drought that can trigger the wildfire. Okay, wildfire dry condition, particularly when combined with the high winds, can fuel large and destructive wildfires. So this is about the climatological. So in that way, we can understand about that. Next, we can see that this is a chart like same a disaster, human disaster, environmental, having the greenhouse effect, deforestation, as we are seeing that uncontrolled town planning, mega cities. In the mega cities, you are seeing that uncontrolled town planning is there, which increase the temperature of the city and the population, drying of the lakes. Technological, we can say like chemistry, nuclear, oil spills. These are the human disasters. Now, natural disasters, we can see already we have seen that biological, epidemic, insect infestation, animal stampede, geophysical earthquake, volcano, mass movement, hydrological, in that we can see that flood, mass movement, wet, meteorological is a storm, climatological, we have seen like extreme temperature, drought, wildfire. So this is the chart where we can understand the human disasters, or you can say man-made disaster or natural disaster. Now we come to the levels of disaster. Level of disaster. In that, we have seen there are three levels. disaster levels are categorized to help understand and respond to emergencies effectively. So level 1, 2, and 3 are typically used to classify disaster based on their severity, the important factor, severity, impact, and the resources required for response. So level 1 incidents are the most severe and requiring the most resources, while the level 3 incidents are the least severe and require the fewest resources. Level 1 disaster having the severity highly impactful and potential catastrophic, overwhelming local resources. That it is written like that: the organization, institution, or community is able to contain the incident using its own resources and can respond effectively. They can use their own resources and can respond effectively. Now, like examples, like major earthquakes are there, floods are there, large-scale industrial accidents are there, widespread outbreak of infectious disease are there. Okay. Now, response in that level 1 require coordinated efforts from state, regional, and federal agencies, including mobilizing substantial resources and potential seeking international assistance. Now, in level 2, assistance can be required by external resources. There is a needed of external resources, however, it can be obtained from nearby authorities. Now, the significant event that required that state level assistance and resource mobilization. Now, as an example, we can say that in that severe weather event like hurricanes, tornadoes, or prolonged droughts, major infrastructure failure, and localized industrial accidents. These are the examples of level 2, and the response right require coordination between the state and the local authorities, with the state providing additional resources and support to local communities. So in this way, it will be in level 2. In level 3, the magnitude of the disaster exceeds the capacity of the local community. It is beyond the capacity of the local community or region, and support is needed at the district or provincial levels. Like minor localized incident that can be typically managed by local authority with minimum external assistance. Examples, there are some examples like that. Okay, response is local emergency response team and resources with potential assistance from the neighboring jurisdictions if needed. Now, there are the factors. Factors are disaster factors that is related with the vulnerability, exposure, and natural hazard, and will give the disaster. So, vulnerability is depend upon the region and the place where there is a risk of that disaster. The place, the location, and the exposure of the disaster. And that natural hazard will give you that a component of a disaster. Risk of disaster. Risk of disaster, having that, we have seen that a natural hazard, a knowledge of potential catastrophic and chronic physical events like past recurrence intervals, feature, probability, speed of onset, magnitude, duration, and spatial extent. Vulnerable system exposure sensitivity and resilience of it depends on resilience of population, economy, land use and development, infrastructure and critical facilities, cultural assets, natural resources. That ability, resource, and willingness to depend upon the mitigate, prepare, respond, and recover. Now we come to the principles of disaster management. Principles of disaster management is an important factors, important thing. That is, one is comprehensive approach. Comprehensive approach means taking into account all relevant aspects of situations or problems, ensuring that nothing important is overlooked or excluded. It involves a holistic and thorough way of considering a subject, issue, or undertaking. Here are like holistic we talking about, that is a comprehensive approach consider the interconnectedness of different parts rather than treating them in isolation. Thorough, it involves a detailed and complete examination of all relevant factors, ensuring nothing is left out. Second is risk reduction and mitigation. So risk reduction is very important. We have to reduce that risk reduction, and mitigation, that is mitigation is the meaning of that it is an action to reduce the loss of life and property by lessening the impact of disaster. Lessening the impact of disaster, that is important. Risk reduction, that the risk of reduction should be, we have to decrease it out, and the mitigation we have to do with that we have to understand that the action to reduce the loss of life, that all actions we have to take in which can be vulnerable for that loss of life and the property. By what? By lessening the impact of disaster. And it is by the mitigation can keep natural hazards like flooding, hurricanes from having catastrophic impact. Like there is a chance of having the disaster, but to reduce the impact of that to the life and the property, we can do that. We can mitigate that. And the third one is preparedness. Preparedness is very important principle to manage a disaster. Like if you are prepared for something, you can reduce the impact of that. And preparation is very important part of principle of disaster management. How we are preparing ourselves as a clinical professional, how we are doing our responsibility to reduce the impact of disaster. Next is effective communication. Is one of the principles. There should be effective communication. Effective communication, like in way we can say that what if there is a place which is having the disaster, any type of disaster, and that the information coming from there should be very transparent, should be very correct. Otherwise, there is some rumors create, and that thing will become more devastating. So there should be effective communication is there. Next is coordination and collaboration. Coordination with your team as you're working as a clinical professional, medical professional. Your coordination with your team members, with your seniors, with your juniors, with all of your team. The coordination should be there, and the collaboration with the government sector, with the collaboration with other NGOs, collaboration with other teams to reduce to work in that disaster management. Next is community participation. Community participation is also a very important part. And next is equity and inclusion. There should be an equity and the inclusion, that all community, all people should be in that surrounding where you are giving the disaster management. Okay. Sustainability and resilience building. Now there is one of the example, like 2023 Turkey Syria earthquake. All of you have seen and listened that in 2023. An overview, we can see that on February 6, 2023, a catastrophic uh, earthquake struck southern Turkey near the Syrian border and becoming one of the deadliest seismic events of the 21st century. The disaster involved two major earthquakes in quick successions and caused widespread and devastation in both countries, further exacerbating the ongoing humanitarian crisis in war-torn Syria. So, screen went wrong.
हेलो.
Yes, screen sharing हो रहा है?
Yes, sir. Yes, sir.
Just a second. Hold
Sir, an overview, na?
Yes.
It's shown.
Actually, मेरे में स्क्रीन आ नहीं रहा अभी.
एक्चुअली यहाँ पर सर दिख रहा है, हम लोगों को तो दिख रहा है. ये आप देख लीजिए, नेटवर्क इशू होगा थोड़ा सा.
हाँ, शायद स्क्रीन चला गया.
इट्स ओके सर, इट्स ओके. सर आप उसको कट करके दोबारा से स्लाइड शो कर दीजिए.
हाँ, वही करने की कोशिश करो.
जी.
हाँ, it's coming ना.
हाँ, यस सर.
कुछ और.
इट इज फर्स्ट स्लाइड, डिजास्टर मैनेजमेंट.
स्लाइड आगे जा रही है. कुछ नेटवर्क इशू है.
यस, मे बी इट्स नेटवर्क इशू.
एक दोबारा शेयर करो.
यस यस यस, नो प्रॉब्लम.
अभी आ रहा है.
यस सर, नाउ इट इज विजिबल.
So we are taking the overview of that. So on February 6, 2023, a catastrophic earthquake struck southern Turkey near the Syrian border, becoming one of the deadliest seismic events of the 21st century. The disaster involved two major earthquakes in quick succession and caused widespread devastation. In that, the seismological details, we can see that is around magnitude. The first quake measured is 7.2 on the Richter scale, and followed by a second major aftershock of 7.5 magnitude. Epicenter it's near Gaziantep and densely populated region in southern Turkey. Yes. Now, As on humanitarian impact, that told over 59,000 life lost, approx 50,000 in plus in Turkey, 9,000 in Syria, with 10,000 injured. Displacement is more than 2.7 million people rendered homeless. Children affected, over 7 million children in both countries were directly impacted, and many losing families or shelter. Vulnerable population, if we talk about, that is our refugees in Syria and Turkey already facing precarious conditions were disproportionately affected. Building collapse, hundreds of thousands of buildings were either destroyed or deemed unsafe. Hospitals and health centers severely damaged and limiting emergency care. That is, hospital and health centers, what happened? Severely damaged and limiting emergency care in Syria. Over 50 health facilities were affected. Economical loss, we can say that estimated loss exceeded $118 billion, with Turkey incurring most of the damage. This is an overview. We can see that. And one of the things which I want to also share with you, that is on 3rd December 1984, over 5 lakh people in the vicinity of the Union Carbide India Limited pesticide plant in Bhopal, Madhya Pradesh. Actually, my education is from Bhopal, and I have my graduation is from the Bhopal Memorial Hospital as a center, and that hospital was established for the people of gas victims. So that time in 1984, there was a chemical disaster, you can say that, and that India were exposed to the highly toxic gas methyl isocyanide, and in what is considered the world's worst industrial disaster. And government affidavit in 2006 stated that the leak caused 5,58,125 injuries, including 38,478 temporary partial injuries and approximately 3,900 severely and permanently disabling injuries. You can see the data of that. And it is in the year of 1984. Estimated vary on the death toll, with the official number of immediate death being 2,259. Other estimate that 8,000 died within 2 weeks after the gas. And another 8,000 or more than have since died from gas-related disease. In 2008, the government of Madhya Pradesh paid compensation to the families. What I am saying is this, that these overview, we can understand that how catastrophic, how dangerous, how destructive these disasters. I have seen the patient when I was in the graduation time in Bhopal Memorial Hospital Center. I have seen the patient of that gas toxin affected people, and who are coming for the treatment. And not even that people were them, but their generations are coming. Their generation are coming for the treatment in that hospital. That time they were not born even. They were not born in 1984. They were born in after 1984, and they are coming for the treatment for that gas disaster, which was happened in Bhopal in 1984. So how these disasters are affecting not even the person who are facing the disaster, but the generations who are coming after him are on the risk, on that point, they are affected with that. So it is important to understand that we as a clinical and a medical professional, how we should be ready to understand our responsibility and the role that we can minimize the things. Even there is a movie was also made on that gas disaster in 1984 in Bhopal was happened. If you have when you see, you will understand that because of that knowledge, because of the information, because of the communication, because of the not preparedness, the things become so worse. So many people were died. If the people will know that the calamity will happen, that disaster will happen, how they have to react, how they have to act on that. So maybe many of the people were not died on that day. So it is very important that we should understand. Even I can give my testimony also in that webinar also, that how I go through that disaster. One of the disaster, that is we can study about the biological disaster. In that I have gone through a train accident, and it was happened in 2004 or 5, I think 2005, in 3rd October. There is a train accident of Bundelkhand Express, and one time I was just studying I was doing my general nursing in Datia, in Rawatpura College, and that time I was traveling from Jhansi to Datia by train. And 2005, I was on 3rd October, I was traveling in Bundelkhand train, and I was on the 3rd bogie of that. And we met with an accident that the train loses their brakes, and in Datia station they put on loop line, and that loop line the train was mashed into the building, which is the building of the lineman building, a double-story building, and all 3, 4, 5 bogies are crushed, and the bogie which I was in, that no one was alive except me. So I have seen that that disaster also. That is a biological or accident disaster. So, and after that, there are 100 people who were died, and more than 400, 500 people were injured. And that time, they all sent to the Datia hospital. And I have gone through that. I have seen that. I have experienced that, how the people will not get the right treatment to the right time, and they lose their life, isn't it? But the thing is that we have that in that district hospital, there are nursing colleges there. So like there are 300, 400 students are there who come to the hospital, and we have done the referral system. Like we have sent the patient some to the Jhansi and some to the Gwalior in that way, and how that people are giving the first aid and everything they are doing. But the thing is that what I feel, that if we are prepared for that, then we can save more life. If we have the good preparation, like principles we are studying about, those principles we are studying about, the preparedness. So if we are prepared for that, we are ready for that, so we can save more life in that. The thing is this. Now we come to the we are now health impact. So health and public health consequences, immediate medical need. It required an immediate medical, as we are talking about, it required an immediate medical need. Crush injuries, orthopedic trauma, burns, hypothermia, psychological trauma. In that, psychological trauma, okay, post traumatic stress disorders, disease of outbreak risk, like and that poor sanitation, overcrowded shelters, and damaged water system, increase the risk of cholera, respiratory infections, and COVID-19 spread. Mental health crisis. Thousands of faced grief. They have lost their loved ones. Anxiety, depressions. They lost their things. They lost their house. They lost their everything. In many situations, many disasters, you can see that. They lost their whole family. So mental health crisis, especially children and orphans. Maternal and neonatal risk, like the women who are pregnant women in shelters, had limited access to obstetric care. So this is a health impact. We can see after disaster, we can see that health and public health consequences, immediate medical need they required. Crush injuries are there. So there are a number of things we have to think about. We have to row in that, in the hierarchy way, in the priority ways. How can we do our responsibility, our role to minimize the destruction of life and the property. Now the disaster risk management cycle. Disaster risk management cycle. It is a mitigation, preparedness, recovery, response, disaster. It's the cycle of that. And mitigation phase. I already told about the mitigation. The mitigation is to prevent or minimize potential damage. Objective in the mitigation phase. The main objective is to prevent or minimize the potential damage. Explanations are like focus on long-term risk reduction. Strategies before a disaster occurs. We have to make our strategy. It depends upon the situation. It depends upon the location. It depends upon the requirement. Like if we talk about the hilly region, there is chances of landslides. If we are near to the like oceans or rivers, there is a risk of flood, tsunamis, isn't it? If we near to the industrial area, then there is a risk of industrial disaster like any chemical explosion or something like that. Like health promotion campaign, objective is like health promotion campaign. We can do that. Like an example, we can see that dengue prevention, flood prone areas. So what we have to do we have to focus on long-term risk reduction. We have to make the strategies before a disaster occurs. Like in the flood area, we have to understand now this is a time of flood. So we have to what? We have to do, we have to make the strategy, we have to make the policy, how to save the people, how to make the people away from that place, what medical facilities they need in that time, what equipment they need at that time, what thing they have to need that time, like they need shelter, they need the food, they need many things at that time. So we have to prepare for that. We have to make the strategy on that. So we can minimize the destruction of them, isn't it? Like advising patient on immunization and safe water practices. And like we are doing taking the example of health promotion campaigns. We have dengue prevention in flood-prone areas, advertising patient on immunization and safe water practices, advocating for resilient hospital infrastructure. So this is the part of mitigation phase. Role of nurse in mitigation. What is the role of nurse in mitigation? Measure designed either to prevent hazard. There are some what measures we are designed, whatever we are designing for that, it is to prevent the hazard from causing emergency or to lessen the likely effect of emergency. We cannot prevent the disaster, but we can minimize the destruction, the loss of life. Okay. As a community assessment, we can knowledge of community resources like emergency services, hospitals and clinics, community health personnel, community government officials and local industries. Now, assessment and diagnosis, risk assessment and analyze. We have to analyze that previous disaster. We have to understand what happened in the previous disaster, what things we have to lack on that. So we have to come over that lacking. Local climate conducive to disaster formation. What is the magnitude, the coping strategy of the locals, current community disaster plan. What is the current community disaster plan? Health personnel available, the number of manpower you have, what number of manpower you have that you can balance or you can work on that as a team. Health facilities, what health facilities we have available, it is satisfactory or not. If we need more, local agencies and organizations are working in that, in what impact, in what way they are working, how they collaborating. So these all are assessments and diagnosis. We have to do that. Now, diagnosis community disaster threats, determine actual and potential disaster threats, preventive measures being taken care of. Is there collaborative activities are undertaken? Are the people aware about it or not? So we have to aware them, we have to train them, we have to educate them. If when the disaster was there, what they have to do and what they don't have to do. So these all are information we have to impart. Community preparedness, that is called community preparedness. This all come in under that community preparedness, that we are preparing the community for facing something which is coming big, something which is hazard, which is destructive. So in this way, the diagnosis community disaster threats that we have seen, determine the actual and potential disaster threat, effectiveness of community-based disaster plan, community awareness, community participation. Now the second phase is preparedness phase. Objective is ensure readiness for effective disaster response, like preparing, making yourself ready. Explanation, pre-disaster planning to enhance community and institutional capacity, like participating in disaster mock drills. We have to do the mock drills, isn't it? Learning emergency procedures. What emergency procedures we have to follow, we have to learn them. Triage protocols are, what are the triage protocols? We have to do that, mock drills on that. Basic life support, we have to understand. We have to learn about that skill. Stocking emergency medical kits, ensuring blood bank preparedness. So this is all the preparedness phase. We have to prepare and make ourselves ready to face something which is destructive. Role of a nurse in disaster preparedness is to ensure the appropriate system, procedures, and resources are in place to promote effective assistance to the disaster victims, thus facilitating relief measures and rehabilitation services. What is the objective is this? To ensure about that, to ensure the appropriate system is there, appropriate system procedures are happening, and what are the resources we have are in place to promote effective assistance to disaster victims. Like sometimes we have the resources, but they are not in the right place to give assistance to the right people. So we have to ensure all these things. And this is the role of a nurse in disaster preparedness, that we have to ensure about the system procedures. We have to understand that those resources which we have, they are in the right place, that we can, when there is a need, we can give them effectively to disaster victims, thus facilitating relief measures and rehabilitation services. What rehabilitation services we are giving? Now, personal preparedness. Personal preparedness is very important, like capacity building. Your capacity building is important. How you are capable of doing, of facing such things, such problems. Readiness to work in the multidisciplinary team. It is very important to work in multidisciplinary team. In disaster, it is not like that, that you can do one thing at one time, or one thing, or you know only one skill. No, it is not. It is not appropriate. Actually, it is needed. It should be a multidisciplinary team. It is to work in the multidisciplinary team in every sector, in every way you can work and help out. Knowledge about community. You should know about community where you are working. You know about the community. You know about their language. You know how you communicate them, how to you collaborate them, how to make them participate, how to you know about their good and bad. Everything about community. Your knowledge should be appropriate. Types of disaster and its management. What type of disaster there is prone to be in that locality, and how you can manage it, you should well prepared for that. Certified first aider and CPR is very important when you're working in as a disaster management. As a clinical nurse, you should know and you should be certified with first aider and CPR. Knowledge about policies and protocols. You should know about the policy and protocols, not even the policies of your working policy, your job responsibility, but you should understand the policy of that district, state, government, the policy of other sectors, how they are working, how you will work with them. That knowledge you should have. And the important thing is communication skill. It is very important to do anything, to do any work on that. Now, it is about the personal preparedness. Now we come to the professional preparedness. Professional preparedness. Prepared disaster preparedness written plan. There should be some plan of that, written plan of that you will work on that. There is some control room over there. There you can deal with all other peripheral regions. How you can work on that. Rapid response team should be there. They should be continuously in practice. How they work. There should be mock drills on that. License and health resources. What health resources you have. Personal equipments, very important, like such as stethoscope, flashlight, extra batteries, cash, warm clothing, heavy jackets. Okay, record keeping materials, pocket size reference books. That's all you have to keep in that. Disaster Management Committee information and communication, use of personal protective devices, disaster beds, logistics support system, training and drills, unity of command with mobile van, standard operating protocols. So this is all about the professional preparedness. We have to think about it. We have to understand about it. We have to learn about it. That how can we use of personal protective devices, disaster bed, logistic support system, what we have to do in that, training and drills continuously should be there, and in service education, unity of command with mobile vans, standard operating protocol should be there, and you communicate with that, you know what standard operating protocols are there to work. Now it is about activation of disaster management plan. Activation. Now it is time to activation. Failure to plan is planning to fail. Those who have no plan, they can be planning to fail. Develop a standard operating procedure. There should be some SOPs you have to follow. The standard operating procedure. There should be some SOPs you have to follow. You have to develop. And on that SOP, you have to work when there is some circumstances of disaster will arise. Isn't it? It's very important. When the disaster will come and you will ready to, and then you will sit and make SOP and you will make some plan that is useless, nothing to use. Because the problem is standing on your head and you are making a plan how to remove it. No, it's not working. You have to make a SOP. You have to make a standard operating procedures, development of that, and you should know, you should well communicate with that. And when then there is a rise of some circumstances of disaster, then on that, according to that SOP, on that, according to policies, you have to you get that policies. You have to work on that. You have to do your action plan according to that. Reception area, disaster control room. There should be a disaster control room you have to make. Triage system you have to make. Documentation at control room. There should be a very important factor that there should be control room. There should be a proper documentation of everything. So public relation management you have to make on that. Crowd management you have to look out. So these all are the working way. Now, disaster impact phase. Objective is acknowledge the occurrence of the disaster and initiate immediate action. It's very important. There are two actions we have to take at one time. That is, you have to acknowledge them, the occurrence of the disaster, and immediate action. That initiative you have to take is that immediate action, what you will take. This is your objective in disaster phase. When the problem coming in front of you, on your head, the important things, you have to acknowledge the occurrence of the disaster and initiate immediate action. And you have to go through that SOP, which we have discussed earlier. Explanation, this is the actual event, natural or man-made, when damage, injuries, and chaos peak, response must be swift and coordinated. There should be no confusion. There should be no misunderstandings. There should be no unplanned things, but there should be a response must be swift and coordinated way. Isn't it? Example like there should be some mass casualty, and mass casualty is there. Triage at hospital entrance. Managing the crush injuries or acute trauma in earthquake. Rapid surveillance of communicable disease or post-disaster. So these are some examples how the situations are different in different disasters. The working pattern is different in different disasters. So you have to work on your SOPs, which you have to go through. Now that is the response phase. Response phase, the objective of response phase is provide emergency relief and save lives. It's very, very clear and very transparent and very, I think, very accurate that your objective as a response phase, your objective is to provide emergency relief and save lives. Isn't it? Explanation, we can go through that, like immediate mobilization of resources to manage disaster effects and stabilize health system. For example, like assisting in casualty management and trauma care, coordinating first aid and mobile medical units, administering tetanus toxoid in wound case post earthquake. There are these things we have to understand what emergency relief we have to give them and how to save them. So, role of nurse in disaster impact and response. What is your role? Actions taken in anticipation of during and immediately after impact to ensure that its effects are minimized and that people are given immediate relief and support. When that effect of the disaster will be minimized, that is the result of your immediate response you have given, and that immediate relief and support you have given. That will the result. That the result is that you have minimized the effect of the disaster by your responsibility, by your role which you have done in that. Now, disaster impact. A set of principles which provide a framework for managing any event. There are 7 C's, we can see that. One is command, other is control, third C is coordination, fourth C is communication, fifth C is clinical management, sixth is continuity, and seventh is capability. That is important. Command shows the leadership, control, coordination with other team members, communication with the community, people who are the sufferers, and the other teams, other management, other government departments. clinical management is a very important one that you have to give you have to show your skills, professional skills on that, and it will be a continuity that response, that relief, giving of relief, giving of response should not be break. It should be in continuity and the capability of doing. Now, nurses' tasks in disaster impact. Some tasks are there. Let's determine the magnitude of the event, how catastrophic is the event was, how disruptive the event was. We have to determine it. Define health need of the affected group. It is very important that you should understand the need of the affected group. The affected group which was facing the problem, the destruction, the disaster, what health needs they want. We should understand, isn't it? अगर किसी को दर्द हो रहा और हम बुखार की दवा देंगे तो उसको आराम नहीं मिलेगा. अगर किसी को बुखार है और हम उसको दर्द की दवा देंगे तो आराम मिलेगा. बुखार में बुखार की दवा देनी पड़ेगी, दर्द में दर्द की दवा देनी. तो we should understand the health need of the affected group. And the third one is establishing the priority. It's very important. Sometimes we do what? We don't understand the priority of giving health care or health management. We should not prioritize those things. It is very important. We have to make the hierarchy of that. We have to prioritize the scenario. What priority is needed to the individual or the community which is affected by some disaster. We have to do what first? So that is establishing the priority. Like for example, if the patient is coming with the MI, what you will do? What is your priority? Isn't it? And the fourth is identify actual and potential public health problem. We have to identify the actual and potential public health problem. What are the actual problem? What is the potential public health problem? We have to identify those things. And when you understand the public health problem, actual problem, then we can give their health need according to that. We can establish the priority according to that, and it will be a working in that pattern will give you a very good result. Determine the resources. Next is determine the resources needed to respond. We have to understand what resources we have, and according to the resources, we have to respond on that. We have to work on that. Maybe sometimes we have good resources are there, and we are not using to save lives. We have to understand, we have to in a very calculative way, we have to determine the resources, what resources we have, and how we will use those resources to them. Now, the other thing is collaborate with other professional disciplines, governmental and non-governmental agencies. As we have talked earlier, that the collaboration with professional disciplines, the collaboration with your team, the coordination with your team is very important. And with that, as well as with that, we have to collaborate with the governmental and non-governmental agencies who are working with you for saving the life and to minimize the destruction of any disaster. Next is maintain a unified chain of command. It is very important. Maintain a unified chain of command. Otherwise, there will be a big confusions. Otherwise, there will be a miscommunications. And otherwise, there will be a misleading, misfollowing of the orders. And your action will not bring any result in that. So we have to maintain a unified chain of command. And the last one is communication is very important on that part, that your communication, scale your communication way you are understanding the communication, the people who are facing the problem, their communication is, they understand you, you understand their problem. Communication is very important. The sharing of information is very important. A correct and transparent information is very important. Now, the role of nurse in disaster impact and response, that a response to alert. Alert, like we're talking about the tribe, like green, additional manpower, less severe, sudden. Amber, large number of casualties. Red, major disasters. Information to supervisor, prepared mobile van. Be in multidisciplinary team. Search, rescue, and first aid. What is we have to do? Search, rescue, and first aid. This is the way we work in disaster management. You have to search, you have to rescue them, and we have to give the first aid. Okay, so there are other teams who are working with you, who are working with the searching the lives. The other team who are rescuing them, who are taking them out from, like there is an earthquake, they are taking them out, the people out from them. And your work, your first aid should be there. You should give according to the priority, according to the need, you have to give the first aid. Distribution of work and delegation of responsibility is very important. That no group will win, but a team will win every time. When you are working in a team, like for example, like in any team, every player has their own responsibility. Like in cricket team, there are some bowler, some good fielders are there, some batsmen are there, there is one keeper is there. So this is example how they delegate the work. They know that the person is good in catching. They put it in, they put and they locate them the place where there is a chances of getting catch. The wicket keeper will not doing the bowling. He is doing his work. He is doing wicket keeping only. The bowler will not come in opening, batsman. But he is not a batsman, he is a bowler. So he will do bowling. A batsman will, a good batsman, a best batsman will come in the opening, and after that there is a series of them. So what I'm telling you is that the team, according to the team, according to the player, according to the person, according to the professional, will delegate the responsibility. Distribution of work. If somebody is good in something, he will do that. If somebody is good in something, he will do that. In this way, we will make a team. We will distribute our work. We can delegate the responsibilities. And in this way, when we work in a team way, we can work in a good way. And we can bring the good result, the best result. We can minimize the destruction. We can save lives in that way. So this is how our role of nurse should be there. Now, disaster impact and response phase. Disaster impact and response phase implementation. Implementation. Field care, tracing and tagging the victims is very important. We have to tracing them. We have to do the tracing them. We have to giving according to their need. We have to give the color coding. Okay, we have to tagging the victims who loses their life. We have to tag them. Care of injured persons. Referral services. We have a knowledge about that. What referral service we have to do and where to send patient. Arranging for physical facilities for the victims. Effective communication. Now, role of nurse in disaster response. Immediate post-disaster interventions, that is immediate post-disaster intervention after as the disaster has happened. What interventions you have to done immediately? Establish safety, the important part. medical treatment and nursing care as per needed, as per requirement, as priority level, what medical treatment, what nursing care you have to give the person, utilization of available resources, what resources you have to utilize them properly, psychological support you have to give them, life-saving measures, first aid, evacuation and supply is important. Supply of what? Supply of shelter, food, water, medicine, communication, maintaining the public morale. It's very important. As a human being, we should understand the person who is going through that destruction, who has gone through that disaster, what morale he is having, what his confidence level, what stress he is having, what anxiety he is having, that you have to maintain the public morale on that. Voluntary receptions, relative waiting areas should be there. Management of infection control is very important. Like there should be no another infection should be created. So management of infection control. Re-arriving post-disaster stress, encourage ventilation, establishing outreach program to provide community support and referral services. Now, recovery phase. It's an important phase. It is a recovery phase. Recovery phase, the objective of recovery phase is rebuild and restore the affected community. It's a very clear objective. Rebuild and restore the affected community. The community which is affected with some disaster, we have to rebuild them, we have to restore them, and go through that like long-term reconstruction and rehabilitation, both infrastructural and psychosocial. Not for only their psychosocial, but also infrastructure. So long-term reconstruction, rehabilitation. So what is the difference between the reconstruction and rehabilitation? What is the difference between the reconstruction and rehabilitation? Like with the example, I can say that, if a person having a chair, and the chair, he is sitting on the chair, and the chair was broken. The chair was broken and he fell down. So, as a rehabilitation, what I will do, I will go and I will just that the chair which he is having, that like we have to maintain it, we have to rebuild it. Are you getting my point? Like इसको थोड़ा सा हम ऐसे लेते हैं कि कोई व्यक्ति है जो कुर्सी पर बैठा है और वो कुर्सी टूट जाती है, जब वो बैठता है उसके ऊपर, तो उस कुर्सी को मैं जाऊंगा रिहेबिलिटेशन फेज में, क्या करूंगा, कुर्सी को जाके जोड़ दूंगा, कुछ कीले ठोकूंगा, और कुछ कील ठोक के और कुछ किसी तरीके से बांध के रस्सी से कैसे भी करके उस चेयर को दोबारा से बना दूंगा ताकि वो चेयर पे बैठ सके. ये हो गया रिहेबिलिटेशन. Now what is reconstruction is this, कि I made a new chair to sit on that. मैं एक नई कुर्सी बनाऊंगा जिसपे वो बैठ सके. So that is a long term reconstruction and rehabilitation. जो भी उस समय लागू हो सकेगा, जो भी हो सकेगा उसको हम करेंगे. Like it is a reconstruction, maybe it is a rehabilitation, both infrastructure and psychosocial way. Are you getting my point? What I'm saying, what I'm trying to saying that. Example, restaining hospital services and immunization drives continuously. Mental health counseling is very important, and post-trauma support. It's very important. The person who is going through that disaster, maybe he lost his loved ones, he lost his family members, he lost his neighbors, he lost his friends, he lost his property, a house, and whatever he loses, he go in a trauma. And that post-trauma support we have to give them by giving the counseling, mental health counseling. Next is follow-up care for chronic conditions. Whatever chronic conditions he's having disrupted during the disaster, we have to continuously follow up care. There is no way that we can just prescribe or care we have given on the time of disaster or post-disaster, but it is a long-term continuing care you have to give to the person who gone through that surface or circumstance in that. The role of a nurse in recovery, rehabilitation, and reconstruction phase is restoration of pre-disaster condition like surveillance and prevention of epidemic outbreak. It's very important. The surveillance or prevention of epidemic outbreaks, water supply, food supply and safety should be there. Control of vectors should be there. Care of survivors, vaccination, counseling, and behavior modification is there. Now, rehabilitation by the health sector and multidisciplinary team. Reconstruction is setting up of shelter, health, food, facility in the campus, education, training of people, students, and volunteers for to face the problems will come again. Training given them. And shelter management plan. Now, nurse can act as a shelter manager. And shelter management is what? Something like you can understand, you should listen to the victims, encourage victims to overcome the crisis. This is the counseling in the way that you have to encourage the victims to overcome the crisis, provide the basic resources. The basic resources, what the basic resources are like food, water, shelter. These are the basic resources we have to give. Provide compassion and dignity to the victim. Rehabilitation by health sector, community cleanup efforts, teaching proper hygiene, alert for environmental health hazards, home visit, and follow-up care. Now, examples of recovery. That is a restore essential services, community rehabilitation. We have to give the counseling, temporary housing, financial support or assistance, health and safety information to them, long-term medical care we have to provide them, physical restoration, public information, conducting economic impact studies. In this way, we can rehabilitate them, reconstruct them, and we come to the recovery phase. Now, the disaster warning. Disaster warning is reduction, identifies several key parties that play major roles in the disaster management, especially disaster warning. Communities, local government, national governments, regional institutions and organizations, international bodies, and the private sectors, media, and scientific communities. There are some channels used for disaster warnings also, like radio, televisions, telephone, short message services, satellite radios, internet, emails, GIs, remote sensing in disasters and management. So these are all the you can say that channels which you can use for disaster management. So as we have gone through the phases of disaster management, disaster preparedness, disaster impact, disaster response, rehabilitation, mitigations, we already seen that. This disaster preparedness we already have discussed on that. That is a definition. You can say the United Nations Disaster Relief Office defined disaster preparedness as a series of measures designed to organize and facilitate timely and effective rescue, relief, and rehabilitation operation in cases of disaster. Measures of preparedness include, among others, setting up disaster relief machinery, formulation of emergency relief plans, training of specific groups to undertake rescue and relief, stockpiling supplies, and earn making funds for relief operations. So that is what the definition of the preparedness. The United Nations Disaster Relief Office have defined disaster preparedness as a series of measures designed to organize and facilitate timely. Very important part is this: to organize them, designed to measure, first to measure, designed to organize, and to facilitate timely. The important part is to facilitate timely and effective rescue, relief, and rehabilitation operation in cases of disaster. As we have like pre-disaster preparedness, ready for the crisis, hazards and vulnerability assessment we have to do. Preparedness for planning and SOPs, capacity building and training, pre-position medical resources. These all are activation of emergency operations. Disaster response. Disaster response is the second phase of the disaster management cycle, encompassing the immediate action taken during and right after disaster to reduce the mortality, stabilize the situation, and initiate the recovery. It is defined by the urgency, coordination, resource mobilization, and medical intervention. Now, primary goal of disaster response is life preservation, rapid rescue, triage, and resuscitation. Life preservation is very important part. That is, a rapid rescue करना है, triage करना है, और resuscitation करना है, which is required. Injury management करना है, on-site and hospital-based care of trauma, burns, crush injuries. Infrastructure stabilization में जाना है, ensuring continuity of critical health services. Outbreak prevention, maintaining sanitation, clean water, and vector control is very important. Prevention, it's outbreak prevention, and it is something like if there is any other infection is outbreaking, we have to do the preventive measures on that. That is maintaining the sanitation, clean water, and vector control. Mental health support, psychological first aid for survivors and responders. Now, 4 components of disaster response. First one is activation of emergency protocol and command system. First important things. In that, hospitals and health agencies must immediately activate their disaster response plan, which include launching the incident command system. This system designates incident commanders, lead the medical and logistic operations. Operations section में क्या होता है? Manages triage, transport and emergency treatment. क्या कर रहा है वहां पे? Incident commander क्या कर रहा है? It will lead the medical and logistic operations. Operations section क्या कर रहा है? It will manage triage, तो manage कर रहा है, transport कर रहा है और emergency treatment provide कर रहा है. Logistics section में ensure oxygen है कि नहीं, मेडिकेशन है कि नहीं, सर्जिकल किट्स है कि नहीं, बेड्स है कि नहीं. पब्लिक इंफॉर्मेशन सेक्शन में उनको कोऑर्डिनेट करना, उनको पब्लिक सेक्टर्स में इंफॉर्मेशन को बताना. ठीक है. नाउ ये हो गया हमारा. आगे बढ़ते हैं. नाउ मास कैजुअलिटी ट्राइज है ना. तो ट्राइज अभी वी ऑलरेडी talked about triage. So triage is the process of prioritizing patient based on the severity of their condition. Triage is a place where or it is a process. What process? It is a process of prioritizing patient based on the severity of their coordination condition, urgency of care needed, and available resources during mass casualty incident. The goal is to maximize survival with limited resources. What is the goal? That is, the goal is to maximize survival. That is the important part. With limited resources, we cannot, all the resources which we have to work on that. The purpose of triage in disaster is rapidly assess. What you have to do? Rapidly assess and classify victims. It's very important. Two-way action you have to take. And two-way action is what? Is this rapidly assess. You have to do the assessment rapidly, fastly. You have to clarify it, calculative in a way. You have to assess the patient, you are the person who is who's facing the problem, and you will classify the victim. And you have to classify the victim to ensure the most effective use of medical resources. Direct critical intervention to the patient who can benefit the most. You have to give the directly critical intervention. Patient who can benefit the most. So person who can be, you can survive him. Prevent outbusting hospitals. Now triage categories, color code system, start triage, start simple triage and rapid treatment. It is widely used globally, especially in pre-hospital disaster scenes. Like in the RAD one is for the immediate phase, immediate. The person which need a immediate treatment. Okay. So that come in the red. Yellow, that can be delayed for some time. He can, like in fracture patient, you can delay. And the person who is dying, that comes in the red, and you have to first survive him, make him survive. Green, some scratches, some wounds. Green, minimum. Black, that is expectant. Patient tagged. Now code red. Patient tagged red need urgent life at saving intervention. Their conditions are critical but treatable if managed quickly. Example including airway obstruction, severe bleeding, shock. This patient are unstable, must be treated first. It should be treated first. It should be in the priority label. It should be in the red code. And we're talking about the yellow, delayed, as is written, a delayed. And that means this group include patient with a serious but not life-threatening injuries. There's no life-threatening injuries are there. So their treatment can be safely delayed without major risk of deterioration. Like already I told you, that patient is having the fracture, moderate burn, abdominal injuries without shock. Now green tag patient have minor injuries happened and he can be able to walk even. These are the walking wounded. You can say that they require basic first aid, outpatient care. They are the last in treatment priority but may help assist others. Now in the black, patient in this category are either deceased or have injuries incompatible with survival given current resources. Example include victims without breathing. They have no breathing, no pulse, who do not respond to airway repositioning. In mass casualty setting, resources are not allocated to this group. There are some parameters we have to do the assessment criteria and start triage. How you can make the person understand how which person which go in which color. So start with 3 basic assessment for rapid triage. Less than 60 seconds. You have only 60 seconds to understand. I already told you that rapid, you have to identify. So respiration, not breathing, open airway, still apneic, black. Breathing, more than 30 minutes per rat is going to red. Less than 30 is going to next step. Perfusion, capillary refilling of pulse. Capillary refilling is more than 2 seconds or absent radial pulse is red. Normal, move to next step. Next step. Went wrong.
Sir, it is over?
Oh, ma'am, actually, something went wrong actually.
Okay, it's okay.
स्क्रीन दिख रहा है आपको?
Yes, sir. It is visible.
सर Here we are. Perfusion, we have seen mental status, unable to follow command is red. Can follow command, it will go into yellow or green. Now, there are some additional things are like special consideration. You can say that is a jump start that is in the pediatric triage system. Children have unique physiological and developmental needs, which is why the jump start system was developed for the triaging pediatric patient during mass casualty events. It is designed for children under 8 years or weighing less than 25 to 30 kg. Step 1 is mobility. If the child can walk, they are triaged as green. If not walking, further assessment is done. Children may not walk due to fear, not injury. Step 2, breathing. If not breathing, open the airway. If it's still apneic, give 5 rescue breathe. If they don't respond, tag them black. If they resume breathing, tag them red. Now, step 3, respiratory rate. If breathing is under 15 or over 45 breaths per minute, this is the abnormal, assign a red tag. Normal breathing indicates further assessment. Perfusion, check capillary refill or pulse. If the absent or delayed, tag the child as red. Normal perfusion lead to mental status evaluation. Step 5, mental status. A child who is unresponsive or has inappropriate reaction, like blank stare, no response to pain, is tagged red. If alert and responsive and no other critical signs are present, tag them yellow. Pregnant women are prioritized. Maternal survival often improves fetal outcome. Elderly may have masked signs, low BP or altered sensorium could be baseline. Chemical and biological disasters add decontamination status to tag. Now, on the surgical, emergency and medical and surgical management. This is where the golden hour principle come into effect. The first 60 minutes post-injury are critical to save lives. That we all know what is golden hour principles. The first 60 minutes, common interventions, airway management, we have to check it out. Like we have to do the intubation or suction. Hemorrhage control, we have to do that. Tourniquets, pressure bandaging. IV fluid resuscitation, we have to do. Surgery, and like debridement है, fracture fixation है, fasciculotomy है, for crush syndrome. Pain management like morphine, ketamine, non-steroid, we can give that. Now, infection prevention and water and sanitation. Post-disaster environment are highly prone to infection. As we already discussed earlier also, the post-disaster environment are highly prone to infectious outbreaks like cholera, like leptospirosis, dengue, and COVID-19. Key intervention is water purification should be there, chlorination ho, boiling ho, letting set up waste disposal proper ho, hand hygiene and mask distribution ho, antibiotic prophylaxis ho in injury-related cases, immunization should be there, tetanus, hepatitis, oral cholera vaccines should be there. Clinical tips: be alert for sign of fever with dehydration, early dengue or leptospirosis. Observe unusual cluster for support for outbreaks. So in this way, we can do psychological first aid and mental health. Disaster often trigger acute stress reactions like panic, PTSD, and survivor guilt. Immediate steps क्या है? Provide safe space देना है, emotional support करना है, listen without pressuring to speak. Normalize stress reaction. This is a normal response to an abnormal situation. Refer high risk cases. Hallucination अगर है, suicidal thoughts to mental health team. We have to give the counseling for them. Now, interagency coordination and logistics. Interagency, it's very important. Coordination is essential among health department and coordination, police fire services coordination, NGOs and international aids like WHO, Medicine Sans Frontiers, local community leaders like who are the key tools to work on that, emergency operation centers for centralized command, medical relief camp, logistic chain for fuel, blood, and ventilators. this is the scenario where you have to coordinate with the people, agencies to minimize the destruction level. Okay. Now, tagging it begins at the scene. Each body is assigned a unique identification number using a disaster victim tag or body tag. The tag includes critical details such as location, found, date, approximate age, sex, visible injuries, clothing, any personal belongings. Bodies are not to be buried so fastly, quickly, or cremated immediately unless public health is at serious risk. Identification of dead. Identification can be done visually by relative, but more formal methods are preferred in chaotic scenarios. These include fingerprints analysis, dental records, forensic pathology, DNA sampling, photographs of the face, distinguishing marks, and any ID cards or jewelry are documented. In this way, you have to do the identification, documentation, records. You have to make on that. Disaster recovery is the final phase of a disaster management cycle aimed at restoring normalcy, infrastructure, health and services, and community life after the response phase concludes. Short-term recovery involves restoring critical services like electricity, water supply, basic health care, waste disposal, temporary shelter, focus on stabilization and immediate needs. Long-term recovery includes rebuilding infrastructures, rehabilitating the economy, restoring the health system, mental health services, which has a long term needed, making the community more resilient to future. Psychosocial support is essential to address trauma. Public health monitoring, you have to do that. Now, summary, disaster management is the organized process of planning, responding to and recovering from disaster to minimize loss of life and damage. The important is what is the important process is that it is a process, it is organized, it is a management is the organized process of planning, responding to and recovering from disaster to minimize loss of life and damage. It involves preparedness, as we already discussed, mitigation, response, and recovery, ensuring timely action and resilience in the face of emergencies. A well-coordinated disaster management system safeguards public health and restore normalcy efficiently. This is a summary. So, as now I am finalizing it, जो संकट के पहले जागे वही संकट के बाद भी टिके, यानी कि those who prepare before crisis are one who endure after it. Thank you. Thank you for listening.
Thank you so much, sir, for the wonderful session. Participate. If there are any question, you can ask. Chat box is open. Students, participants, if there are any question, you can ask. Sir, I think they understand very well. Your session is very wonderful, amazing. You explain very well. Thank you, sir.
Thank you, ma'am.
Ma'am is here.
जय हिंद, गुड इवनिंग लविन सर, कैसे
जय
आप?
हिंद. Good evening, ma'am. Good evening. I'm good. आप कैसे हैं, ma'am?
Thank you so much. I was in between coming and going. We have some issues in college, so we were busy in that. Thank you so much for joining us in this series, and it is really we are blessed to have such a speakers. I think this is the last class today, isn't it?
Yes,
Manisha?
ma'am. Yes, ma'am.
So this is the last class we have, and you are the closing candidates of this series. So dear participants, this was the first series of medical, surgical, and adult health nursing. We are soon coming with the second series. the leftover systems will be covered in that. And just like Levin sir is sitting in front of us and other speakers, you must enjoy the class, you learn a lot. And I'm damn sure whether you are putting your feedback or not, you learn a lot, because these things you are not getting anywhere. And whatever they have taught you, this is today disaster management sir has taken, and before that all the system wise classes were there, and the emergency management was taken by Deepak sir, I hope so. And the morning class, what was the system, Manisha ma'am, today?
Renal system, ma'am. Renal disorder.
Renal disorders were there with the ma'am Jyoti madam, I was not there. So I need your feedback. If it is really going well, we can continue with the other series. And you will really enjoy and learn a lot with the series. I am getting the feedback from other faculties from other universities that we are doing good job. But the learner,
Yes.
you are the only one people from whom we want to know that is it really you are learning a lot and we are doing very well as a Samarpan group. So really please do gives your feedbacks just now in the text box. If 5 6 are coming also, I will be happy to see the feedbacks. And if I talk about the speakers, we are still just connecting with the other speakers with the other leftover systems. And I hope Levin sir will have you again in someone, because
Yours.
there are many systems are left over and it is not easy to complete together. So you take 1 week rest and definitely will again come. If you are interested, you can join, you can register. So thank you so much. All the students who are connected directly and indirectly with webinar series of medical, surgical, nursing. Thankful to you all that you have faith and believe on Samarpan Group. We assuring you that we will continue with these type of series, and the educational board will put in front of you, and definitely we will give you benefits in the field of nursing. So once again, I really thank to Levin sir for such a wonderful class.
Thank you. You're
He
welcome.
was enjoying to take class because we lived together for 2 years, very
Yes.
fast, near about, I think, more than 20, I think
2000,
20,
more than
and
15 years, 16,
15
17 years,
years we were there.
70 years.
Yes. So
I raised that topic also, like in disaster management related with the BMHRC hospital, that gas that gas disaster over there.
okay.
I told the students that the patients are coming still in their hospital when we are when we are studying over there. We have seen that scenario over there.
Yes. So just think, today also one or two students came, they said these things are happening with me, something from the college. I said, when any disaster will come, how you will manage? So being a human being and being a nurse, we have to be always ready 24/7 for any emergency and disaster. And we are born to serve to the humanity, and before that we must take care of ourselves. So next we'll definitely cover the infection control, है ना, वो भी हम लोग देख लेंगे इसमें लेने के लिए. तो ये एक अच्छा था. I am getting feedback in the chat box. I think this started. Like a very informative session, most knowledgeable class. Thank you so much, sir. So yes, all the classes were very good, and this class was the last, and this was about the disaster. So please take care, go through with all the sessions. We'll put the notes, isn't it, Manisha madam? आप ready है notes के लिए? नोट्स ग्रुप में जरूर डालने हैं, सभी को नोट्स मिलेंगे, एंड एवरीवन डेफिनेटली गेट देयर certificate also. Okay, so you will get all your stuff what we already promised you. And thank you so much. Take care, be healthy, be safe. We'll definitely going to meet in the second series of same message webinar, because we have to complete it, then we'll come with the research series. So thank you everyone. Thank you once again, Lavin sir. Thank you,
Thank
team
you, madam.
Samarkand.
Thank you.
Today they are on leave. after half day they are sitting in the home and they are running the show from their own home. So thank you so much to team Samarpan for having such a bond and creating such an environment. The many means number of people are learning from you. So you are really my support system. So I thank all my Samarpan team. I thank all the delegates who believed and participated. Thank you so much. Be connected with us. We'll boost again and again. Thank you everyone who connected indirectly and directly with Samarpan. We will always be there for you. Thank you. Have a good day. Take care. Bye bye. Jai Hind.
Jai Hind.
Jai Hind, ma'am. Thank you.